Four factors. Four factors that must be addressed post-surgically and are often not addressed. And I'm a big proponent of people getting physical therapy after surgery. However, physical therapy often doesn't address these four factors. One is brain balance, left and right brain balance. Anesthesia often knocks that off, and one side of the brain will go down compared to the other, and a person will have decreased muscle tone on that side of the body. Their autonomic nervous system will be affected, and things like their memory and concentration can be affected, or they can be more prone to feeling down or feeling anxiety. And this needs to be addressed with our brain balance adjustment, which really gets at the frontal lobes of the brain and helps get those balanced. Then the person will be more effective in their physical therapy because their muscle tone will be more equal, their posture will be better. An additional factor to that is sometimes the brain just gets disorganized with anesthesia, and the person then may need to do our neurofeedback so the brain can get information on what it's doing and reset itself and rebalance itself so the person can focus and concentrate better and they don't have any memory loss. And that's an issue for people, especially as we get older and get surgeries. It's easy to trigger some memory loss from the anesthesia. So the neurofeedback can help a lot with that. The second factor is to deal with the scar. And so the scar is often not addressed very well with PT either. And so we need to get in there and torque that scar and reset it with the light, and stretch the scar and reset it with the light, and tap into it and reset it with the light and with the adjustments. And we have a whole video on scar, releasing scars and the importance of that. The scar needs to be dealt with because one, it will cause tissue pull. Two, it will block acupuncture energy. And three, it gives scrambling information to the brain. And so the scar needs to be addressed. Thirdly, the myotomes need to be addressed. Those are the connections between the brain and the muscle, and that connection is often lost. I just checked my brother last night, who's 7 months out of a hip surgery. He had 4 myotomes weak on the side of his hip surgery, and he had physical therapy, and he's been to a chiropractor at least a half a dozen times, and that was not addressed, and he was having trouble walking. Well, no wonder, because he had weaknesses, multiple weaknesses. 3 of those weaknesses came through the sciatic nerve area. And what may happen there is that in the surgery, the clamps may push against that sciatic nerve and create some disturbance there. And unless that gets rebooted with what we do with quantum neurology, and you can see how we strengthen muscles on another video, then there may be some long-term problems with that. The fourth thing that needs to be addressed is the sensory nervous system. Often with surgery, as we cut in through as the doctor cuts in through tissues, the sensory nervous system gets disturbed, and that's things like light touch, deep touch, pressure, vibration, hot, cold, and proprioception, sense of position in space. And so we also have a video on that, how we reset the sensory nervous system through quantum neurology, and so I would refer you to that video as well. So those are 4 things, 4 must be addressed situations for maximum recovery after surgery. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined. Subscribe to us here on YouTube so you get more of this kind of information, and like us on Facebook.